Hello, welcome.
Okay, and Dr. Campbell, I assume, is getting ready. So while we wait for him, I will start asking questions. Okay, so the first question, just to clarify, in terms of when they look in the United States at deaths, what is the top cause of death, and how long has it been the top cause of death? You could both or either of you answer that.
I'll take a stab at it, but it really goes back well beyond 40 years, probably till around, I would say, 1960s, when people really began to appreciate how widespread cardiovascular disease has been, although it actually probably became number one shortly after 1920. But the thing that's been so frustrating about it is that despite we have all these marvelous techniques being used in cardiology today, we really haven't changed the fact that cardiovascular disease remains the number one killer. And I think we have some very strong feelings about how that can change.
Okay, and cardiovascular disease means heart attacks, it means strokes. Is that what it means, those two things? Is there anything else associated with cardiovascular?
Yes, it also affects the legs as well as the heart and the brain. Yes, pretty much. Matter of fact, earlier today when I was to make a presentation, I'll add another one, and that is just in being involved in this business for 39 years, it was the first time that I had a patient who had a 75% occlusion of the superior mesenteric artery. And he began getting pain in his abdomen in October and November of 2023. And eventually in the 29th of December of 2023, they obtained a CT with contrast and found there was a 75% blockage of the superior mesenteric. Unfortunately, this is unusual. He got a hold of me about a week after he had that scan, and he totally committed himself to whole food plant-based nutrition. And 2.5 weeks later after that, his pain went away in his abdomen. And a week later, on the 7th of February, he had another scan, and the 75% blockage was completely gone.
Thank you.
If I can jump in there, it's wonderful to be with you guys tonight. And I think you're talking about the most important thing that we can talk about, which is, but I want to just add a little bit of color to what Dr. Esselstyn has said. Number one, it's leading killer of people around the world, heart disease is, okay? But it's only in the middle income and low income countries, except for the United States. The United States is the only high income country where heart disease remains number one. Stop talking about the world and go into the United States. There's a nice review from the CDC about the leading causes of death, and they list the number one cause as food, and our food choices. And so people get to choose how long they live about 4 times a day, 3 meals and an exercise session that they do or they don't do. And the fact of the matter is we have and decreasing life expectancy. A lot of that has to do with drug addiction and issues that are happening, premature early heart disease. We have so much diabetes and obesity that are increasing in the country. And the most recent data says that we continue to have worsening healthcare disparities. It used to be all about race, and we were talking about and talk about it all the time. You know, African Americans having more heart disease, 30% higher mortality, more kidney disease, more stroke. But South Asians, the population is actually increasing. They have even more than African Americans. And the fact that the matter is, it's all food choices having to do with those two cultures. And so if you look at the numbers, it's estimated that about 80% of our very toxic and expensive healthcare system is chronic disease based on nutrition choices that people make. So I'm glad you're doing this 17-day conference. I'm hoping you get to, I know conferences like these are often so-called preaching to the choir. I value that because I think everyone in the choir needs to be singing out of the same hymn book and to get the best result and get the message out to everyone. Everyone in the sound of our voices should become a loud ambassador for a whole food, plant-based diet, exercise, substance avoidance, good sleep, good mindfulness, and a good loving environment. That's the 6 principles of lifestyle medicine.
Now, in addition to heart disease and stroke, is erectile dysfunction also a part of cardiovascular health?
It often can be, and we have seen remarkable reversal of erectile dysfunction in patients when they change lifestyle and they improve their vasculature, and the blockages seem to go away. As a matter of fact, right now I'm involved with my good friend Robert Osfeld from Montefiore Hospital, New York, and we're writing an abstract and a case report of a resolution of erectile dysfunction. So yes, it's very important, and it's wonderful to think that patients can turn this around.
So we do have, I actually was fortunate to be asked to speak at the American Society or American Urologic Society in Atlanta last year. Dr. Terry Mason is a urologist who's been a real, I'm pretty sure you've had Terry on your show or on your, in your list of speakers in the past or even maybe this year. And he's a retired urologist. The data is actually fairly strong, and I'm glad to see that there's a randomized trial that's looking at it. But the data is pretty strong that vascular function is affected by your diet, and the people who have less atherosclerosis have less urologic dysfunction. And so, and I don't want to just leave it, the urology discussion, since I had to look it up and make a bunch of slides. Fact of the matter is, it isn't just erectile function. It's actually prostate cancer, as you know from Dean Ornish's work, and prostate hypertrophy, all of which are fed by animal products. And if we could actually just back that down and improve the diet, whole food, plant-based diet, we would actually improve this tremendously.
Okay, so
Can you hear me?
hello, Dr. Campbell.
Yes.
Now. Hi, we
Thank
can
you.
see and hear you.
Sorry for the, can you hear me?
Yep, we see and hear you.
Okay, great.
Thank you. So just to finish up on this line of thinking, so if the number one cause of death in the United States is cardiovascular disease, and it has been for 40 years, and it causes heart disease and strokes and erectile dysfunction and problems with your legs and other problems, and it's the number one cause of death. The punchline big question is, if we do all the things you tell us to do and we do them very well, how much of a reduction are we getting? Are we getting a 3%, a 5%, a 50%? In other words, there's a lot of people I know who don't seem, I'm very affected by what you say, but my friends are not. They continue to not make these changes. So I don't know if they understanding the benefits. So how much benefit is there? How much less of a risk do you have of a heart attack, a stroke, or these other problems if you followed your guidance very carefully?
So you want me to take that one? So I know I'm a chair of medicine now, and I do a lot more administrative stuff and have to do a lot of internal medicine, not just cardiology. But I can tell you that when you take the highest risk patients, which are the ones that are coming to a cardiology clinic, typically after a stroke or a heart attack with peripheral artery disease that you mentioned, we actually can stop the events. If you get to our American College of Cardiology, American Heart Association target LDL cholesterol, and it's not that LDL is the only thing. There's Lp(a), there's inflammation, all of which improve with a whole food plant-based diet. And so we have an opportunity when we have people in the clinic to get them on guideline-directed medication plus plant-based diet. And if we do that, I just don't see any more cardiac events. And I've only been doing this about 20 years, but in that, or 21 years, I haven't had anyone have an event. So it's a little tough to answer your question. You know, I know Dr. Esselstyn has some data, and Dean Ornish had percentage decrease in plaque. But it's the issue there is that it's not about the plaque. It's about the vulnerable plaque. And that's what happens when you get your LDL cholesterol down. You get the vulnerable plaque to go away. So you could keep your narrowed artery, but that'll a plaque that never breaks is the one that doesn't give a heart attack or a stroke.
Can
Dr.
I-
Sure.
Yeah. Yeah, I'd like to make a comment on what Dr. Williams just said. And of course, Dr. Esselstyn, if you said anything in the meanwhile. But, recently, in the last 10 years or so, I've really been impressed with the kind of changes that can occur through nutrition. And what I was able to do was to go back and collect correlation studies from a number of researchers all the way back to the 1950s, having to do with heart disease, kidney disease, liver cancer, and so forth. Really quite impressive. Now, correlation studies are judged to be not indications of causation. That's really wrong, because when we do those things, it's wrong. It's right when we assume there's a single cause. And of course, a single cause amongst, let's say, hundreds or thousands of other possibilities. So that's entirely appropriate on the one hand. But on the other hand, all these charts that I actually found, correlation studies, are really impressive. Straight line relationship from the XY origin straight up, as soon as with respect to animal protein intake, which is an indication, of course, the kind of diet we're talking about. And of course, it's not just the animal protein, it's the ratio of animal to plant protein. So in that particular case, on the y-axis, if you will, for the independent variable, they all show the same thing. It's really remarkable. As I say, from prostate cancer to colon cancer to heart disease to kidney, all of that. And so when you look at the highest rates in the world compared to the lowest rates, it's all linear regression, almost come right through the XY origin. Really impressive stuff. And of course, at the time they did those studies, those researchers were referring to one food or maybe one nutrient, if you will, at the time, but they all are saying exactly the same thing. And so in theory, what it shows that I'm suggesting, they all show about, a decrease of 60, 70, maybe 80% of these diseases, these chronic degenerative diseases, all the same. All the same. It's really quite remarkable. As I say, I want to emphasize they're not to be negated by the fact that, correlation doesn't need causation. That's only appropriate if we think there's one cause. But when we think about this collectively, as Dr. Williams and Dr. Esselstyn have done, take an old diet, a whole food plant-based diet, you see remarkable results as they have seen. And so from the population point of view, it's fully supported by what they're saying or what those studies show. Those studies have been kind of hidden from view. And we've not paid any attention to them because we're always laboring under this so-called criticism of correlation not equal causation. If you take the collective, just one thing, ratio of animal to plant food. So I'm really very excited about these kind of data. Developed by others since the 1950s. They all show the same thing, regardless of the degenerative disease. It's really, really impressive.
Steve, just to reinforce what Kim and Colin have said, we reported 200 patients in 2014. 200 patients who had been seriously ill with heart disease. 2 were lost to follow-up. Of the 198, we found that 177 were adhering to and following our program of whole food plant-based nutrition. And over the next close to 4 years, there were 0 major cardiac events, heart attack, stroke, and death. Where on the other hand, the patients that did not follow the program, those 21 patients, 62% had disease progression.
So, Dr. Esselstyn, that is beyond remarkable. The question is, has this been replicated? Has this been done anywhere else? Like that study alone is just in case anyone wasn't clear, you said 198 patients that you personally was supervising. Is that correct?
That's correct.
Very good. And you're saying 177 of them were I'm sorry, the 177. Say it again, so I say it.
177 were those that were adherent to our program, and those 177 over close to 4 years of follow-up had no disease progression. That is, no major events, heart attack, stroke, and death. On the other hand, the 21 patients who were not following the program over that same time period, those 21 patients, 62% had disease progression.
Right. So the question is, this is remarkable. This is the biggest data point I can imagine. Has anyone followed up on it? Has anyone done a bigger study? Has anyone been able to make this happen again in a bigger way?
Well, I'd like to try to do it again. We have now another 1,686 patients that we have treated, which we have not yet followed up. And if we can find the time and the energy and the coin, we'll maybe we'll be able to do that. We're looking forward to it.
Okay.
So let me add to this. You've hit on a really kind of sore point in the plant-based nutrition world. We have a lot of, as Dr. Campbell was saying, we have a lot of association. We have a lot of correlation. We have a lot of basic science, plaque regression with Dr. Esselstyn. But what we don't have